going to let Andy tell you more about the TARC.
Hi, everybody. My name is Andy Capehart. Welcome to the webinar. I want to go over just a quick disclaimer before we get started. The Adult Protective Services Technical Assistance Resource Center is a project of the U.S. Administration for Community Living, Administration on Aging, Department of Health and Human Services, administered by WRMA Incorporated. Contractors' findings, conclusions, and points of view do not necessarily represent policy of the federal government. And like Lori said, a quick note about the APS Technical Assistance Resource Center. We're here to help APS programs in any way that we can. Just reach out to us. Our contact information will be displayed at the end of this webinar. Also consider joining our APS TARC listserv. There's a flyer about the listserv with instructions on how to join in the handout section of your GoToWebinar control panel, so you can download that anytime you like. Just a bit of housekeeping before we get started. This session is being recorded and will be posted to the web at a later date. We'll notify all the attendees via email when it is posted online. You may use your telephone or your computer to connect to audio. Just select the option you prefer on your GoToWebinar control panel. An example is displayed here, or you can make your selection. It's circled in purple. All participants are muted for the webinar, so there's no need to mute your line manually. And then if you have any questions about our presenters, simply type them into the questions box. An example of where to type those is on this slide. It's also circled in purple. You don't have to wait until we pause for questions. You can submit your questions anytime you like. And when we do pause, we'll get to them in succession in order we receive them and ask them of our presenter. So now I think what we'll do is launch a quick poll just to get an idea of who our audience is. I'm going to launch this right now. You should have on your screen the question and the options. Just click on what applies best to you, whether you are an adult protective services professional, other social services professional, medical, legal, or other. You can make your selection directly by clicking on the screen. So we'll keep this open for about 30 more seconds, giving a chance for everybody who's with us to make a selection. And then we'll share the results with everybody. Keep it open for just a little bit longer. Again, you can make your selection by just clicking right on your screen and selecting what fits the closest with your profession. So I think we'll give it about 10 more minutes and then we'll close the poll.
Andy, don't give them 10 more minutes.
Oh, I'm sorry, 10 more seconds is what I meant to say, 10 more seconds. So I'm going to close the poll out now, and then I'll share the results with everybody. It looks like 91% of you are APS professionals. 7% work in some other form of social services profession, a few medical folks, a few legal folks, and a few that fit into other as well. So that's to make it today's group. And I'm going to hide that poll now and then turn things back over to Lori. Lori, the floor is yours.
Hi, everyone. I want to introduce our speaker for today. This is Carol Kubota. She is a geriatric social worker by profession. She's had 20 years of experience in working with both APS and older adults across the lifespan. She was an APS supervisor in Orange County for 7 years, and then for 13 years she was their principal trainer down in Orange County, California, and that's how I came to know of her, and I've watched her train. I think you're really going to enjoy her, and I'm going to turn that over to Carol.
Well, thank you for that nice introduction, Lori, and thank all of you for coming out and sharing this webinar with us during what I know is a very busy season. Before we begin, I just want to point out that we have several handouts that are available to you. The first handout is the curriculum handout, which I call Supervisor as Trainer. The other one is, show my screen. Are you not? There we go. Okay, and the other one is the Field Guide for APS. And then we have the Texas Worker Interview Skills Evaluation Tool, WISE, and then we have the slides from this presentation. I will be referencing these two documents, actually these three documents throughout the training. But I did want to just note that the curriculum handout and the field guide for APS are intended to be used in their soft copy or electronic format. The reason being is there are several hyperlinks to different resources or other documents that you want to be able to access through the hyperlinks. Okay, so let's get started. The first rule of a trainer is you never, ever, ever read the PowerPoint, okay? And I'm going to break that rule. Participants will be knowledgeable of the basic tenets of adult learning and Kolb's learning theory and the implications of these tenets training new workers. What that means in simple English is we are going to talk about theory and how it applies to practice. Learning objective 2, participants will be able to recognize different learning preferences and styles and will recognize how training activities best suited to those styles and preferences. So we'll learn about learning styles and the best ways to train people who have those styles. Learning objective 3, participants will be knowledgeable in APS specific performance evaluation tool, which is the worker interview skills evaluation, WISE, and how to provide effective feedback to workers regardless of what evaluation tool you use. So if you happen to be an APS supervisor, thank you, thank you, thank you. And to all the APS workers who may be on the line, thank you too, because ours is a very thankless job, and I know what goes into it. But as a supervisor, I used to think that my supervisor was sitting in their office drinking coffee and, playing solitaire. But what I came to understand when I became one is, golly gee, there's not enough time in the day to do what we need to do. So as a frontline supervisor, we have to do clinical supervision, which talks about how to coach workers to become, to handle specific cases, develop critical thinking skills, how to manage their caseload, how they document, and helping them develop their professional identity. We do also do community representation. That means serving on a community community groups such as the multidisciplinary team meetings. We provide education to senior centers, law enforcement, nursing homes about adult abuse and what APS can do. Managing personnel issues, a big chunk of time, if you have any personnel issues, goes into this category. We hire, fire, transfer, and promote workers. And that takes a lot of time. And probably the thing that requires the most time that I found was progressive discipline, helping the person who is not meeting their job expectations to come up to standards and documenting the process. Ensuring providing backup coverage. In all the years I've worked in social services, I've never known any social service agency to be fully staffed. There's always somebody on leave of absence. There's always somebody sick or on vacation, or you just never were able to hire enough people. So as supervisors, we're called upon to, do follow-up calls and sometimes even go out and do the investigations ourselves. Ensuring compliance and quality assurance. That means we're meeting all our mandated timeframes, that all the cases have the required case elements. And if you sign off on your workers' work, you are basically doing a lot of reading, because your signature certifies that they complied with what you know to be best practices with APS. And last but not least, this is probably the most important aspect to training, in my opinion, and that's role modeling best practices. We know that based on parallel process, the way that we engage with our workers, if we demonstrate patience, reflective listening, focus on strengths, that they will take that as a normative way to communicate, and they will reflect that in their practice when they work with their clients. So modeling is an extremely important and yet subtle aspect of our training of new workers. And in addition to all that, we get to train new workers. So here's my question. Annie, I'm going to ask you to launch this poll. What's your
Certainly.
experience? What percentage of your time is spent training your new workers? So Andy's going to open the poll and we'll get some feedback from that poll.
And people are voting right now, and we'll leave it open for just a little bit. Now I'll share the results. Give it about 10 more seconds or so. You can make your selection just like before. Just click on the screen to whatever corresponds with the best answer for you. And folks are still voting a little bit. We'll give just a few more seconds. And I'm going to close that poll out and then share it with everybody so you can see the results. It looks like the vast majority of folks are saying 26% to 50%. So about a third of people said they were spending 26 to 50% of their time.
Awesome, awesome, awesome. So I think that one of the things that we recognize that there are many challenges to being a supervisor who has to train new workers. And the first being for a lot of us is insufficient time. With all the other things that we have to do, being a trainer is requires a lot of time, as indicated. 26 to 50% of some of our supervisors have to dedicate their time to. Another challenge for supervisors is the lack of experience or expertise with training. One of the things that happened when I became a supervisor was I was a relatively competent investigating social worker. And the day I promoted to an APS supervisor, we had emergencies and I was the on-call supervisor, and I came home, burst into tears, and told my husband, I have made a very grave mistake, because I went from being a competent person to a mediocrely competent person, and it was very humbling. So one of the things we're going to talk about in this training is some tools that will help us be more efficient with our time and sort of expand our knowledge base on how we can most effectively help new workers learn. Lack of training related resources or budget. We know that when times are lean, training is the first thing that gets set aside. But I will say that regardless of that, we have a lot of resources available to us, which we'll review today. Lack of standardized established curriculum. Most places, depending on where you're coming from, some places have a very formal training program, others it's kind of ad hoc, but we do have to have consistency amongst our unit or our agency how we train. Lack of overall training plan, just like a client service plan, a training plan needs to be a collaborative document that is worked out with the supervisor and the new worker on what they need to acquire and by when. And then limited evaluation resources, and evaluation is probably one of the most underutilized aspects of training, because it's the only way that our workers get feedback on their performance and a direction on which they need to take. Most new workers, especially if they're brand new to the field, they don't even know what they don't know, so they can't even formulate the questions. So evaluation is a good time to review the job expectations and also provide feedback on how we can get from point A to point B in their skill development. Just like us, our new workers often have a lot of challenges that interfere with their learning. One of the first one is fear of making mistakes. And this is particularly true with people who are coming from the academic community, because they're always being judged and graded. It's also common with people who are very experienced. Maybe their professional ego says, well, I can't let people know that I don't know this because I should know it. And that whole sense of, I guess, wanting to be seen as better than other people sometimes interferes with their ability to take information in. Non-relevant materials. Adult learners do not want the fluff They just want the bullets. Lack of participation. This is generally not true with new workers. It's more for our experienced workers. And part of our role as a supervisor is to engage them so that they will participate, to create the circumstances by which they understand this is in my best interest to learn. Fear of change, I think that that's normal. We all want to be comfortable, and when we know what we're doing, we want to stay there. When we don't know what we're doing, it's, again, it can be very unsettling to people. Formal atmosphere, that's that sage on the stage, you know, the professorial lecturer who just says, okay, I'm going to tell you everything and you just listen. There's not a lot of dynamic dialogue there. And that really is not a great way to train adults. That may have been the way we trained kids, but not the way that we teach adults. And then finally, unlearning ineffective habits. This is an interesting one because I know that we often hire people from different social service arenas, such as child welfare or behavioral health. And a child welfare worker may have a very difficult time appreciating that we oftentimes leave clients in high-risk situations or downright unsafe situations, because in child welfare, that wouldn't happen. Similarly, if somebody's coming from doing the 50-minute psychotherapeutic hour, they may have a hard time not wanting to do psychotherapy at their home visits. So we have to lay down the foundation. APS is a crisis intervention social services agency. We don't have time to do that. We refer them to the resources that can provide that. But again, for people who feel competent in those areas, it's hard for them to adopt new skills because their whole perspective comes from a different arena. So in adult learning theory, I like this quote because it kind of sums up how adults learn. I hear and I forget, I see and I remember, I do and I understand. So this sort of speaks to the fact that experiential learning is one of the best ways that adults can absorb skills into their being. So based on that, adult learning theory says that adults learn best when learning takes place in a supportive environment. Kind of is intuitive, right? But one of the things as a supervisor, we have to create that supportive environment by letting the worker know we don't expect them to be perfect. Nobody's perfect. And when they do make a mistake or they take a misstep in their caseload or in some kind of interaction, we see that as an opportunity for them to learn and to ask the question, what did you learn from this experience and what might you do differently the next time it occurs? Information is practical and relevant. That means they're only going to learn what they need to learn for their job. They may or may not have an interest in, the whole etiology of hoarding behavior or, how you intervene in substance abuse families. They may have interest in that, but what they will really want to learn is that which is applicable to the work that they do. Information is applied shortly after acquisition. We all know that people's memories, and some of us have worse memories than others, if you don't apply it within 24 to 48 hours, you will probably not recall it. So if you're talking, for example, you're meeting with a new worker and you're talking about, let's say, the domestic violence cycle, make sure that they go and see a domestic violence client situation in the next 48 hours, because then it'll resonate with them. Oh yes, I remember my supervisor said that there's this cycle, and right now they're in the honeymoon period, and she's probably not going to want to throw her husband out or whatever. Information, adults learn best when information is chunked. That means, again, you're not giving the whole theory and history of hoarding behavior. You're basically looking at all of the practice as a process. So, for example, for the new worker, you're not going to give them a caseload and set them free. You're basically going to say, okay, what do you need? when you get an intake? What do you need to review on the intake? What do you need to prepare for the field? What do you do when you go to a client's home on an unannounced home visit? And so you chunk those sequences of the process so that they have an understanding of the flow and the interconnectivity of the chunks. And information is reinforced through repetition. We're all like that. That's why commercials work. I can't tell you how many drug commercials I watch on CNN where I go, wow, I probably need to buy that drug because I see it 25 times an hour. So repetition, repeat, 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 and not just you. If it's a really critical aspect of their learning, it should be repeated by other workers and by other supervisors and managers. Okay. What do training programs look like? Structured versus non-structured. Most of us have a combination of these, but in this particular dynamic, structured programs are when you have a set curriculum, strict timelines. It's usually the supervisor, or if you're lucky enough to have a training department, the trainers from the training department, and it's expected that they'll finish this training within 4 weeks or whatever. Non-structured is basically the way I was trained because we didn't have luxuries like a training department. So it was, my supervisor, and bless her heart, when I started in 1997, she handed me my policy and procedure manual, handed me a couple cases and said, read the P&Ps, look over the cases, and talk to me if you have any questions. And I went, what? So it was a little bit frightening. And I had field experience before I came into APS. But non-structured, it's just kind of ad hoc. As people need to learn things, they're given that information. Regardless, though, if you have a structured, non-structured, or a blended program, you want to remember that you as the supervisor influence the learning of the worker more than anything else. By your interest in their learning, you convey that the agency and you personally value their learning and that you want them to become more competent professionals as they go forward. So, what kind of trainer are you? Well, I will posit the type of trainer you are is the type of learner you are, which is one of the things that we will be looking at in the next few minutes. So if I like to learn in a certain manner, I will train in that manner, even if the person receiving that information is not suited to that type of training venue. So on page 2 of your supervisor's trainer handout, and by the way, I'm going to reference these, but I'm not going to show these documents. There are 4 types of trainers who are identified. Type A is the type of person who basically is the professor in the college lecture. They just like to hear themselves, I shouldn't say they like to hear themselves talk. Sorry, I just misspoke. They're the people who just like to convey information. There's no dialogue, there's no dynamic. It's I'm the sage on the stage and you will open up your minds and learn this. So the advantage is they probably have a good grounding in theory, but they don't know if their learners are actually engaged in the learning process. Type B, these are the warm, fuzzy type trainers or supervisors. They're very encouraging and interactive, but they may not have a good grasp on concepts or guiding the worker. Style C, and I kind of fall into this category, these are the flamboyant performers, the wannabe stand-up comedians. They're entertaining, but they have a hard time with structure and goal achievement. And style D, these are the sort of cerebral trainers. They're the ones who understand the rationale. They know about, root cause analysis, but they may not be tuned into their workers' feelings and dynamics as it relates to different types of cases. So just want to call that to your attention. And again, you know, we're not going to go into all of the handouts. I'm just going to reference them, and you're going to be able to read them at your leisure. So this may look a little familiar to you. Back in the it used to be VAC, visual, auditory, kinesthetic, but now it's VARC. Back in the 1920s, educators believed that people learned and took in information in different ways, and that included the visual, auditory, and kinesthetic. In the 1990s, however, they added read, write because it was apparent that they were classifying this category under visual, the visual learners. So visual learners are the ones that learn best through symbols, maps, diagrams, infographics. They like conceptual information presented in an abstract format that's visual. Auditory learners, these are the people who learn through lectures or stuff. These are also the people, quite frankly, who talk, they think out loud. I'm going to tell one of my little stories. One of my fellow trainers, I'd ask her if we could flip rooms. I could get her room because I had a larger class. And all I wanted her to say was yes or no. But what she would do was she'd go, Carol, you know, the last time we traded rooms, the air conditioning wasn't working in that room and people got confused and la, la, la. All I wanted her to say was yes, no. But what it was she was thinking out loud. She was an auditory learner. These are also the people who frequently talk to themselves. And so these are cues to how they learn best. Read, write learners, I kind of fall into this category, and many academics are in this category. These are the people who love the written word, and they take copious amounts of notes. They're hooked on the internet. They're the ones who go, when you say, hey, who was it that said thus and such? They're immediately on their phone Googling the quote and finding out because they love information. Read, write learners, they generally do well in any profession because they have good oral communication skills and they have excellent written communication skills, which is pretty much a plus in any job that they would perform. And last but not least, these are the kinesthetic learners. These are the learners who learn best by watching videos of real life situations or actually engaging in role play. Shadowing is a real good way kinesthetic learners learn. And, you know, these are the ones who will buy a cabinet from IKEA, and instead of reading the manual, they just throw that away and they'll just get onto it and try and figure it out. They fiddle with things. They learn through doing, and they are not afraid of taking risks. So on page 3 and 4 of your handout is the VARC questionnaire. And it can be administered to you. What I would recommend is that you administer it to yourself, make copies, and administer it to your workers so that you can find out which style, what learning activities will best be suited for their learning. Page 5 and 6 explains how to score the questionnaire and how each style learns best, and it offers some suggestions on different learning activities. Okay, Kolb's learning styles. We are not going to go into this in a great detail. I mean, there are actually college year-long classes that go into Kolb's experiential learning. But I did want to touch base on it because most everyone has to have a foundational understanding of the process of learning. So, excuse me, Kolb said that when we experience anything from which we learn, we experience it either through feeling about it or thinking about it. And once we experience the information, then what do we do with that information? We either watch or we will do. And so as a cycle, new workers will be divergers. They will always say, I don't know what I don't know. I'll go out and shadow this worker and see what they do, what is actually involved in an APS interview. Divergers are always going to be imaginative. They have good people skills. They recognize that there are problems. They're very open-minded to learning. So these are your new workers. Assimilators are your, generally in the learning process, these are going to be the people between 6 and 12 months who have gotten down a lot under their belt. They feel confident, and they know how to apply concepts, but they do not feel comfortable yet in actually doing the work independently. Convergers, these are the people with at least a year of experience generally. We know that, just an aside, we know that for anyone to be competent in any job, it usually takes 18 to 24 months for them to master the foundational skills and some of the higher level skills. But, you know, in their first year, they're not going to have all of it. Certainly not in APS, because APS is so nebulous. And accommodating, these are your veteran or most experienced social workers. They're the ones who know intuitively what to do and how to do it, because they have integrated the concepts and the practice based on their experience. So I just wanted to leave that to you. And like I said, this chart is available in your handout if you really want to learn more about it. On page 7 of your handout. And if you're really interested, go onto the internet and Google Kolb's experiential learning theory. You will find mountains of resources for that. Okay, but in the interest of time, we're not going to dwell on it. I am going to get to a place where I'm going to ask, what questions do you have about VARC learning preferences and Kolb learning styles? And I'll ask either Andy or Lori to give me those questions. Hello?
We do not have any questions. We do not have any questions written in the question box. Let me check.
Is everyone eating their lunch? That's fine. If you don't have any questions, we can always pick them up later. But
yep.
I do want to make sure that you have that foundational information about VARC and Kolb. Okay. So now let's move on to what do we actually train workers on?
Oh, Carol, it looks like there is one question that just popped out a second ago.
Okay.
It says, is there a learning style you prefer?
Well, as I said earlier, I am a kinesthetic learner, but I do have a lot of read-write. And that's usually to my preference. That's how I will train intuitively, because that's how I like to learn. So as a supervisor, as a trainer, you're going to want to identify, are you a kinesthetic learner or something like that? And identify the learning style of your worker, because you want to adapt your learning activities to how they will receive and process the information best. And so that's why I would suggest, when you have a new worker, give them the VARC questionnaire, and it asks them good questions about, you know, how do you learn best? What way do you prefer to receive information? And then as a supervisor, you'll have to amend your style and your learning activities to help them learn in the best possible way. Hope that answers your question. Any other questions?
I'm not seeing any other questions pop. Oh, let's see. Wait a minute. I think something did just pop up. Hold on. Do you think experiential learning is the future of learning, and why? That's Ralph Pascal, who you know.
Ralph. Thank you, Ralph. I think that I really don't know. And the reason I say that is we are relying more and more on electronic means, such as a webinar, to conduct training. It's cost effective. Is it the best way? In my personal opinion, I believe interactivity is a critical aspect of learning. So consequently, I believe experiential learning is the best way to learn for people, as long as it's debriefed and explained. But I also know that it may not be as time efficient or cost efficient as doing stuff like webinars or videos. And by the way, videos can be an experiential training module. And we're going to talk a little bit about the videos that have been made available to APS across the United States in a little bit.
Okay, Carol, we have one more and then we probably need to move on.
Okay.
Can you test for learning styles during the interview? And is there a preferred style for supervisors that's different than for frontline staff?
The answer to the second question is no. If you learn in a particular style, you learn in a particular style no matter what your position is, no matter what your job criteria is. It's the way that you take in and process information, not the skills themselves that you concentrate on. And the first question, I don't know. It sounds like it would be an HR nightmare. You know, you're not going to hire me because I'm a visual learner and you only want kinesthetic, you know what I'm saying? So, no, I don't know if you can actually screen for that at the interview, but I also would say this. You don't want everybody of the same type because things get stagnant. Our clients are never the same. Why would you want your workers to have the same learning styles? Some workers do very well with, you know, financial abuse cases. Other people do well with substance abuse cases. And it's because they have not only the skill set, but they have the inclination to work with those people. Similarly, you want to have a diverse learning group in your unit. Okay, so let's move on because I just realized we're halfway through. And Andy, quick question. This is an hour and a half or an hour and 15 minutes?
It's technically an hour and a half, so you have up to that amount of time or less.
Okay, well, I'm going to try and get us through before then. That's a long time, especially for those people who are out there eating their lunch and they have to go back to work. Okay, so new poll. What do you believe is the most important thing to train new workers on? And Andy, I'm going to ask you to launch that poll and let's see what we get.
Certainly. That's up on the screen right now, and just like with the other polls, just click on the screen to make your selection about what you believe is the most important thing to train new workers. And we have responses rolling in. We will leave it up for just a little bit. Folks are still voting. We'll give it about 10 more seconds. I'm going to close it out here in just a couple seconds. All right, and then I will share those results with everybody. You can see those on your screen. Looks like critical thinking is 40%, followed by agency policies, state regulations, 31%.
I am so happy that you guys think critical thinking is the most important thing. Yay, yay, because I believe that too. But regardless, what I think or what we may think, it is really contingent upon the level of experience that our workers have. Some people have never even mastered the policies and procedures, which I think is just foundational. So those are usually the people who aren't meeting standards because they're not following the policies and procedures. So we amend our training curriculum oftentimes to teach the most needed first. So if you have somebody who already has done extensive field work as a public guardian and now they're an APS worker, they're probably not going to need to start at here are how you engage with a demented client or something like that. So we're going to go over standardized training, and the importance of it is we know that if we don't have standardized training, we have inconsistencies and we have actually personnel problems, because if I wasn't trained on it and I failed to do it, then if I'm not meeting performance standards, I'm going to say, well, I was never trained on it. So training always, that you train each worker with the same information, not necessarily in the same way, but give them the same information is crucial. In terms of standardized training, we also are striving for consistency. In case findings, and I know this has been an issue across the United States, it should be that a APS worker in Delaware, given the a set of circumstances, will come up with the same finding for the allegation as a worker in Montana. But sometimes if you don't have consistent training, people are just going to, oh, it was unfounded or unsubstantiated, because they don't want to make a mistake. So there should be consistency there. Improved outcomes, we know the better they're trained, the more effective they will be as APS workers, create more effective service plans, and be able to execute those service plans. And last but not least, reduce liability for the agency. So when we look at training, be sure to set aside one-on-one time with your worker. And I know this is a tough request, but make sure, if at all possible, you have no interruptions. Step away from your computer, mute your phone, just like you ask them to do in meetings, and give your worker your undivided attention. One of the meta messages of that is, I as a supervisor, value your training time. I want you to succeed, and I'm willing to commit my time and attention to helping that happen. Enlist colleagues for training. We know that we oftentimes send new workers out with our more experienced workers, but also supervisors in other units or in other agencies, give them some exposure to that. I know that one of the things we do in Orange County is we have lunch and learns once a month, where a lot of the service providers within the community will join together, and senior centers, public guardian, the ombudsman, APS, some of the legal professionals and some of the banks will come together, and they'll have a lunch and learn from an expert on financial abuse, for example, or on how to diagnose different levels of physical abuse. And the nice thing about those kind of lunch and learns, this is an aside, but I think it's really important, it gives an opportunity for workers to know the key players in the community in a positive setting, because you don't want to be calling these people out of the blue when you've never met them. So it gives them an opportunity to network. Open door and ad hoc availability. Again, I had a supervisor who I could only see her at a set time unless it was an absolute emergency. I didn't do well with that. Again, you have to take into consideration how your learner has comfort with, knowing how to, how shall I say, restrain themselves and not be reactive in an emergency. Sometimes what we consider emergencies are what the worker considers an emergency is not an emergency by the supervisor. So I will call your attention to one of the other handouts, the field guide for APS. And in the interest of time, we're not going to review it. It's over 100 pages long, but it reviews the different types of training criteria, what the competencies are that are expected of an APS worker. And in terms of unit meetings, I would recommend, and again, this is a recommendation, whenever you have a unit meeting, make sure that you set aside 10 to 15 minutes as an educational component. Again, the message is we're all learning, not just the new worker, and that you value learning and training. And also, if you're doing an educational component that's interactive, it helps our workers connect with one another. As we move more and more toward telecommuting, a lot of people are kind of losing their connection with their team. And so they're less likely to call on people to go on team meetings, or they may not know the expertise of their colleagues. So it's a good way. Unit meetings are the one time we have where all of our unit is together. And so use it to help them build a sense of camaraderie and team. Okay, so training tools for supervisors. We all have this available regardless of our training budget. Case studies, reviewing cases that have demonstrated either best practices or were really problematic. What did we learn? How can we do better? Videos. The Academy for Professional Excellence in San Diego has just produced 6 very realistic APS videos directed for APS trainers. And also YouTube. I will tell you that YouTube is a wealth of information. I've learned everything from how to change a colostomy bag to learning a TED Talk on mindfulness. It's a great resource, but of course it's very huge. Written information, that's kind of self-explanatory, P&Ps and documents, what have you. Brainstorming. This is, you provide a challenging situation at a unit meeting or between yourself and the new worker and ask them to come up with resolutions or alternatives how to work with this situation. Critical incidents. I think of critical incidents as those APS cases that hit the front page of the newspaper. But it's also, some of the politically sensitive cases where, the county supervisor's mother is self-neglecting and we have to treat it as a confidential case. So how do we make sure that that we don't overextend or underextend ourselves in those cases? Also, critical incidents address things like disaster planning with our clients. So, if you have to evacuate your clients, how can we make sure that they're staying as safe as they can be? What is our communication? How does that interrupt the service plan? Shadowing, going out with experienced or skilled workers and observing their interview and investigative skills. I would recommend if you have your workers shadow, have them shadow with as many different people as possible because they will learn, they're trying to learn their own APS style. And being exposed to different styles, they'll say, hey, this person phrases this really well, or the way she got that information, I really liked. That was very subtle. So that you want to give them exposure to a variety of places or learning styles. Games are just fun ways of learning. And, one of the things about games, oftentimes they spark competition, fun competition. And that leads to more learning or the idea of really thinking about how can I win this game. So there's stuff like scavenger hunts and bingo for APS terms and let's see, in the matching learning, the handout, matching learning styles and training methods, on page 8 of your handout, there is this chart that shows different types of learning activities and which learning style benefits most. And you'll notice on this highlighted page, some of the learning activities lend themselves to all across the board learning styles. So those are the ones that you probably want to focus on because then you're hitting, regardless of their learning style, that even the auditory and the visual learning are getting something out of this. So with regards to other training activities, many are included in your APS field guide for APS. And on page 9 and 10 of your handout, we have a medication review exercise. We have the rat feces documentation exercise on page 11, which the workers read a document description written by an APS worker, and then they answer questions about can they ascertain the accuracy of the written document. And then there's the scavenger hunt on for community resources on page 13, 15. And if you have any, share them with your colleagues because we all don't think about these as training, but they really are. Games are real fun. I love games. So kind of burned through that one. What questions do you have about matching training exercises to learning styles and preferences?
All right, let's see. We've got some more questions. Any advice for dealing with a senior APS worker who thinks they already know everything and is not willing to learn new practices?
Sorry. You must have had my unit. It's interesting because those people have no motivation to learn. So the question is, are they performing their job at the level of competency that they are able to get a meets or satisfactorily meets their performance evaluation? If they are, then you're just going to have to, how shall I say, limit their engagement with other workers, because they're too, for lack of a better word, I'm going to say they're too arrogant. They lack the humility to want to learn. And you can't, it's the old saying, you can bring a horse to water, but you can't make them drink. If they don't want to learn, heck, they're not going to learn. So unless you can create the circumstances by which they need to learn, say, for example, they start on the progressive discipline process because they have not met the expectations of their job. But if they have, then you kind of just have to limit their influence in your unit. That's my personal thing. I don't know if anyone else has something to say about that, but you know, they are hard to work with. And we always have a couple of those in our units somewhere. And I do want to say this also, if they know everything, then ask them to present at a unit meeting their knowledge. Because I will tell you, the competent workers will challenge their practice. And it's not to put them down or anything, but it's so that they can understand that it's not just about their performance. Their performance affects the unit, and it affects you. So those are my recommendations.
Okay, let's see. I've got another question here. It looks like it's also someone who's working at a minimum level and doesn't improve an expected area after 7 months of intensive training. I'm not sure there's a question there, but there's certainly a frustration there.
Yeah. Oh, golly gee. If any of us, if any of you in the audience have dealt with the progressive discipline process, which is actually moving to have some kind of consequence to their underperforming, it takes God's age. But quite frankly, it's worth it, because hello? A lot of people, as I said, people will not learn unless they feel compelled to learn or they feel they want to learn. And they won't want to learn unless they need to learn. So the question is, again, if they're not meeting the baseline competencies of an APS worker, and you've given 7 months, we should have been documenting that and saying we met with her on February 2nd, March 2nd, June 2nd, and you have to set the criteria by which you expect them to show improvement. So if they have 20% of their cases are not meeting the mandated timeframes, you would expect by date in September, by 2 months from now, after this meeting, I expect you to have all of your cases under 30 days or 5% of your cases under 30 days. And if they don't, you document that and you move forward, because they're not meeting the competencies of the job description. And here's the thing, it really blows out your morale in your unit because your other workers are having to take on the slack. It demoralizes other people. They're going, well, Mary's not doing thus and such, so why should I? So it really behooves us, if they're not meeting expectations, start that process early. Let them know, hey, I know you can do it. Let's talk about some strategies and move forward on it. But be sure to document your meetings, because even if you're not going through the progressive discipline route, once they get to the place where you're going, I got to terminate them or something like that, you have to have enough, you have to demonstrate that you try to work with them as best you can.
Okay, Carol, I'm going to do one more question and then I think we're going to have to move on. But this this one is, how can I teach my unit and if I'm still learning as a new supervisor?
Great question. Great question. I like that question. You say, I'm still learning as a supervisor. You be real upfront with it. I was fortunate or unfortunate enough to actually promote in the unit of my peers. So they knew I was learning as a supervisor. So, I mean, a lot of it has to do with your own attitude toward learning. We're all learning in this together. Nobody knows everything. So, you know, if you do some of these games or you have some of these videos, you're going to be engaged in the learning process as much as the worker is. And don't be ashamed of it. You can't know everything. Like I said, the first day I went to as an APS supervisor, I went home crying and said, Michael, I should never have promoted. Because I went from being completely competent as an APS investigating social worker to somebody who had to handle personnel issues the first day, and there was an emergency, and we got a call from one of the board of supervisors, and I mean, it just all came out, and I just said, oh no, I have to go back. So, you know, be real with your workers, and they'll appreciate that. I mean, you know, social workers, by and large, unless they're completely compassion fatigued out, they will appreciate your honesty. They will. Okay, that's it.
Thank you, Carol.
Okay, so sorry I didn't get to everything, but we're going to move on. Okay, I referred to the NAPSA core competencies, and again, these are in your field guide. What we know about training and professionals, generally, if you're talking about a brand new social worker, new to the field, new to APS, it generally takes 18 to 24 months before they have enough foundational competency to really say, to identify with that role. I am an APS worker and I'm good, I'm adequate at what I do. Some people, you know, take more or less, it'll take a little bit less or a little bit more. But for the brand spanking new worker, at least 18 to 24 months is the expected training period. And sometimes it goes longer. You'll find the core competencies listed on page 19 of your handout, and they're also in the field guide for APS. I did want to just point this out while I have you guys here. This is the Academy for Professional Excellence, and in San Diego, and these are the videos that they developed for APS training. They're only about 2 to 3 minutes long, but you can see home visit interview on self-neglect, APS self-neglect interview gone wrong, so you would show it and say, hey, what could they have done differently? How to interview perpetrators, how to interview alleged neglect allegations and alleged financial abuse. So I just want to call that to your attention. These are available to any of you, and I saw all of them. I think they are very, very well done. Connect. Oh, did I get us out of GoToWebinar? No, I didn't. There it is. Sarah, sorry. The session is already running. Okay.
No, that's okay. You just need to go back to your PowerPoint window, Carol.
Oh, hello. There we go. Yay! Thank you, Andy. Okay. As many of you noted, critical thinking skills are probably the most important thing that an APS worker can learn. They're important to learn and they're hard to train. There are those people who are very concrete thinkers, and if they don't have good critical thinking skills, they'll probably do a very superficial investigation that'll place the client at risk and it'll increase the liability for the agency. So critical thinking skills are underlie pretty much every skill that they will need to utilize as they become investigating APS workers. So, you know, for example, the ability to analyze information and form a judgment is the basis for how do you determine findings on an allegation. If they don't know how to put together the objective things that they saw and heard and formulate a finding, then that's really a baseline skill for an APS worker. The other aspect of critical thinking is they need to be able to answer the question, how does my taking this action or not taking this action serve the best interest of my client? And that's the phrase I always use when I talk with people. Tell me how this serves the best interest of the client. And if they can't tell me, then the next question was, how does this serve liability for the agency? Those are the two questions I asked them to consider. So that ability to project their actions on future situations or future conditions is also critical. So teaching critical thinking skills. Once again, we know modeling is one of the best ways to train teaching critical thinking skills. The way in which you engage with your worker. Say, for example, instead of saying, did you call the doctor on that case? You might say, how might you have found more information about the client's medical conditions? What do you know about the medications that she takes that would lead you to know some of her medical conditions? You ask open-ended questions that engage their ability to process information and be able to articulate that to you. Because quite frankly, if the question, if a worker can articulate to me how whatever decision they made serves in the best interest of the client, then I can back them, even if the outcome is not the most positive. And I think that that's very true with all supervisors. You know, policy and procedures are very important, but if you can say, I did this because, not because of the policy and procedure, but because by doing this, I enhanced their safety, I promoted their well-being. Okay. Focus on process, not outcome. And this is, again, this is one of those things, when I first came into APS, and like a lot of new APS workers, I said, I'm going to make these people safe. We focus on promoting safety. We do not make clients safe. And how many times have your workers left a client in a high-risk situation? We've given them the information, we've counseled them on what actions they might take, and yet they say, no, I'm going to have my drug-addicted son stay with me, and even though he's taken my credit card, he's my son, and I can't see him homeless. You just document that like crazy. So when people come to you, oh my gosh, I left this lady in a bad situation, focus on the things that they did to promote her safety. And, I always make the analogy, we plant seeds. I know every APS unit across the United States has what we call the frequent flyers, the ones who come back over and over again. They're very frustrating to the workers. They use a lot of our resources. However, what we're doing is we are planting seeds. At one point or another, there may be that breakthrough moment when they say, yes, I will accept the service plan and I will clean out my house, or I'll toss my son out, or whatever it is. In teaching critical thinking, we also look for themes such as if you're talking about domestic violence cases or substance abuse, make sure that they understand that this is a collective problem in our society, that they're going to see a lot of domestic violence. They're going to see a lot of people who hoard. And it's not up to us to fix them. one of the things that I think is very important for brand spanking new social workers to learn is professional boundaries. That comes with experience and debriefing some of the more problematic cases. So if they have the theme of overdoing with sweet little grandmotherly people because they remind her of her grandmother, you have to really address that. And if it's really deep-seated, you recommend therapy or get her to do something else to get help, to establish a professional boundary between herself and those types of clients. I talked about the best interest of clients. The other thing I want to just also say that's not on this slide, be careful of how you refer to your clients. Try to avoid pejorative terms like dysfunctional and pack rat and alcoholic and crazy as crazy, because again, you want to model respectful reference to these people so that again, it will become a normative way for your worker to see their clients and see the humanity in their clients, not just as a case, but as someone who has difficulties with mental health or is struggling with opioid addiction. So all in all, just think of your discussions with your new workers as opportunities. If they disagree with you, hear them out, because again, we are all learning, and I was learning even as an APS supervisor well into my 8th year of being a supervisor. Okay, so here's the question. We've given them all these wonderful experiences. We've debriefed all their trainings. We've let them read all this stuff. How do we know they've gotten the material? So the word supervisor means from Latin oversee. That means we actually have to see their practice, which means we actually have to go out with them and observe them engaging with their clients. This creates a lot of anxiety for your workers. They're going to freak out. Even my veteran workers would go, really, you're coming out with me? And I said, I have to. I have to document what I observe in order to give an effective and balanced assessment of your performance. So when we say application to the job, are they meeting the minimum qualifications of the job description? And your job description should entail the core competencies that are expected within your agency. Above and beyond the APS NAPSA 23 core competencies, they have to have that. Go out with your workers at least a couple times a year, if you can, because everyone's entitled to having a kind of off day. The first time I went out with my supervisor when I was learning, the client not only denied me access at the door, but we couldn't get out of the locked parking lot. She and I had to call the police department to let us out of the locked parking lot. It was not a good day. So make sure that you understand the impact of on the client outcomes, as far as, are they consistently, do you see patterns in their work? Are they consistently not finding the client, or are they consistently always having unfounded conclusions on allegations? That's stuff that you have to address. And we're going to talk about the evaluation process in a second. Use of standardized evaluation tools. Most agencies have their own evaluation tool, but I do want to call your attention to the WISE tool. And we're going to look at that. You have this tool available in your handout. This tool, the Worker Interview Skills Evaluation, was developed by Texas Department of Family and Protective Services specifically for APS. It assesses investigative and interview skills so that when you go out, you actually assess these particular components by direct observation. There are 9 items that are included in the WISE eval. the ratings are on a scale of 1 to 5. You can also use this as a self-assessment, which I didn't have this available to me when I was a supervisor, but when you go out with a new worker, for example, give them the WISE interviews, the paper, have them rate themselves, and then you rate them, and then come together and look at any discrepancies, because that will tell you if the worker can accurately perceive where their strengths and their deficiencies are. And you want to do this consistently. If you're going to do it once, do it the next time you do the next home visit with them. Alrighty. So, elements of evaluation. For brand new social workers, you're going to want to ask them where they see their strengths and their areas of deficiencies, and they may or may not be able to answer that question. If they have some history in social services or as a professional, they will be able to say, well, I want to work on my documentation skills. Great. For new workers in 3 to 6 months, they should be able to identify what their strengths and their areas for development are. And we would engage in, you would look at their interpersonal skills, their investigative skills, critical thinking skills, and their documentation skills. For APS, the WISE does cover all of these, but again, if you don't want to use the WISE, make sure that you have some reference in your annual performance evaluation that has the breakdown of these categories, because these are global core competencies for APS. Coaching versus bossing. We all want to be coaches. Coaches, they lead and inspire. They're collaborative. They are focused on the future and the development of the individual, versus bossing, which is, they're focused on the past and liability. I will say most of the time we should be coaching, but there are times when we have to boss, and those are the emergency situations where, gee, the worker's calling you from the field and says, she's bleeding, but she doesn't want me to call the paramedics. That's not a time to dialogue about, well, what do you believe is in the best interest of the client? That's the time you say, tell her that you're going to call the paramedics, and if she doesn't want to go with them, she can tell them, right? That's an emergency. And you have to be able to, as a supervisor, discern. And it's easy to boss, but it does not serve the best interests of your worker as they develop as leaders or as effective social workers. So, all right. When you have to give effective feedback to a worker on their performance, and they're deficient in some area that's really affecting their evaluation or having poor outcomes for their clients, we have to make an effort to offer them feedback so they can correct that behavior. So the elements of a effective critique include inquiry. We ask them, tell me why. What was your rationale for performing your work in that way? They need to be able to, again, articulate that with the underlying in the best interest of the client, or how it serves the agency. And I know we always say best interest of the client trumps agency, but we also know the realities of liability. So for example, if your worker has a lot of cases, like 40 cases that have gone beyond 30 days, you have to say, explain to me what is happening that you have 40 cases that are beyond the 30-day deadline. Help me to understand why that's happening. And then we do a generalization. You discuss their strengths and you discuss what needs to change. So we might say something, you connect with your clients and it's evident from your documentation, you have very thoughtful care plans. However, the ability to close cases in a timely manner is important to ensure that we are able to serve all of our clients with equity and efficiently. And it might also, impact the unit, and if it does, you tell them that. Data is really important, and these are the objective pieces of information that support why you came to the conclusions that you did about their underperformance. So in a lot of case management programs, you can compare your workers or your units' activities to each other. So you might say, for example, in the case of the worker who's got 40 open cases that are past 30 days, you might say the rest of the unit only carries 5 to 10% of their clients longer than 30 days. Your rate is 80%. And there is an expectation based on our performance criteria that you come down to the 5 to 10% range. Then you talk to them about the theory and activities that they can do to work on that particular issue. How can you demonstrate that you've reached that? How can I support you in lowering your 30-day and over caseload? Ask them to articulate why it's important for them to take action and some strategies that they can use. Brainstorm if they can't come up with it, because it's important that they engage in this process themselves. Just like a service plan, a worker should be engaged in a training plan. And the training plan should have specific criteria to knowing when they've met the objective and a time frame. So objective is, well, I know that we're going to work on this. We're going to reduce your caseload, or we're only going to give you a couple of self-neglecting clients for a while till you can get your other cases down. By September, I want to have all of your caseload to 5% or less that have 30 days or more. And make sure at the end of your critique or your discussion that you have confidence that the worker can come to you and ask for help if they're not able to perform in the way that you had designated in their learning plan or their training plan. And that you have confidence that they can achieve this goal. They can. You wouldn't have hired them if they didn't have the basic criteria to manage a caseload. But there is an art to it, and we all know that there's so many things that APS workers do. Sometimes caseload closure can be tough, and whether it's they're having counter-transference or they don't know how to deal with these more problematic cases. These are things where you can help them, guide them in where their skill levels need to be on the training plan. The elements of effective critique can be found on page 20 and 21 of your handout. And again, please review these at your leisure. I have just brushed over them because of the interest of time. And also on pages 22 and 24, there are 4 scenarios in which a supervisor needs to provide feedback for a worker who's underperforming. And you can role play with your new workers, you can role play with your experienced workers, you can role play with your managers and supervisors. And I would actually recommend, if you have the opportunity, to role play with other supervisors and managers. The reason being is, again, we very seldom get to witness the ways in which other supervisors supervise their unit. So it would be nice to observe in a role play how they would respond to some of these situations. Again, it would help us develop our own supervisory practice and skills. So it's 12:21. What questions do you have on evaluation criteria and offering effective feedback to your workers?
Carol, hi. One of the questions that came in was, is there copyright issues about using the Wiser tool? And it is my understanding that Texas has given permission to have that tool in this training and for people to use it. Is that correct?
It's my understanding because they gave NAPSA permission to use it on their supervisory trainings. So yes, I think you're okay as long as you don't publish it or whatever. But yeah, they have generously offered to allow this to be spread out across the United States. And one thing about the WISE, it doesn't cover documentation. So you will have to have a different format for evaluating their documentation skills. And go ahead.
That's a great segue, because one of the questions that we got is, hold on, I've lost it in here, but it was basically, how do you teach documentation? Everybody complains about that piece.
Okay, first of all, there is a e-learning and the Academy for Professional Excellence on documentation, and there's also an instructor-led one, so that if you as a trainer want to do a full day documentation, you can. You know those videos I showed you? Have them watch the video and document. That's a good experiential exercise. Here's a couple things. If they do not write proper grammar, there's misspellings, the client changes gender in the middle of the write-up, those are not your responsibility to train. That means that they do not have a rudimentary command of the English language written. And if they're at that level, then I would recommend that they go to a college, a local community college, and learn how to do that. Now, granted, we have a lot of people who English is a second language, but I have to say, in every APS unit I've seen, command of written English is a basic criteria for the job. So it becomes very important that it's not your job as a supervisor to teach them basic English. However, if they're incorporating into their documentation judgmental language, or they're, putting in fluff. I had one worker who would write novels. I mean, I knew that the woman was coming out in pink curlers and blue fuzzy slippers. And what I used to say to her is, anything you document should either support the findings or the service plan, the need for APS involvement. If it does not support, whatever you document should do one of those two things. And if it doesn't, don't put it in. Judgmental language, you just have to go through that. So like in the documentation the documentation training, there's this exercise where you read this document that a APS worker wrote, and then you trim the fat. It's called putting documentation diet. And you tell them, okay, read this, tell me what's not necessarily to be put in. And again, I use the criteria, and I try to reinforce with my workers, you only put in that which serves your investigation or serves the service plan. If it doesn't, then leave it out. But I would encourage you, because I know documentation is the biggest bugaboo in the world, and it takes a lot of time to read all that stuff. Have your workers too, and this is the other thing, your workers can help educate their colleagues if you do case reviews with your unit. I know there's this thing about confidentiality and stuff, but we used to have case reviews and would ask, a worker would say, hey, I'm wondering why you phrased it like this. Doesn't that seem like, it's a judgment? So I hope that answers your question.
Okay, we have one more question that unless someone writes more after this. How do you teach assessing the whole situation and not just a reference that's in the report?
Yeah, that goes along with critical thinking skills, right? And many APS workers, and I'm not faulting them, but again, we as supervisors have to promote their ability to open their vision beyond the report. So much of our client is left out on reports. I mean, I would get reports where it says skinny lady looks unkept and it was anonymously reported. You don't know what you're walking into. So again, I think that one of the basic things about teaching critical thinking skills is doing some games or going on home visits with experienced workers who know how to take in the entire environment. And you have to consider client safety. You also have to consider worker safety. You have to consider what resources are actually available to remedy what you see. And so sometimes, and I have to say this, sometimes the workers are so overwhelmed with their caseload that they'll only have tunnel vision to what is on the report. I'll only address the physical abuse allegation. And you as a supervisor, us as supervisors, we need to say we assess the whole person as a preventative means so that this won't come back as, it's a physical allegation to this time, but it might be financial abuse the next time because the drug addicted son who has no means of supporting themselves is now currently living in the home. So you help them by promoting we assess the whole person, and you encourage them to go out with people who do have those comprehensive and global assessment skills. I hope that helps.
Thank you very much. Well, we are at the bottom of the hour, and so I would just like to say, Carol, thank you so much for this this webinar. Given the bulk of the questions we got, I think it was very well received. And with that, we will let you all go. Thank you, Andy, for all your technical help, and have a good day.
Thank you, everybody. Have a wonderful week and happy training. Bye-bye.